Welcome back to Midday Kentucky, everyone. Well, Georgetown Bariatrics and Advanced Surgical Services is on the forefront of providing metabolic surgery for the fighting of diseases and type 2 diabetes and obesity. Dr. Eric Smith has performed well over 1,000 of these procedures and has impressive outcome stats. We have Dr. Eric Smith here with two of his amazing patients with their success stories, Christina and Nikki. How are we both?
Great.
Okay, I love when we do these type of shows where we get to see the before and afters and have that conversation of the journey.
Absolutely.
Okay, and people at home love to see those results. How are you, my friend?
Doing good.
Let's talk a little bit about both of these ladies and what procedures you decided to do on them.
So both of these ladies had surgery within about, I think, a week or a week and a half of each other. They can tell you more about that. And they both had a robotic sleeve gastrectomy, which is the most common surgery that we do at our practice, as well as the most common surgery done in the United States for weight loss surgery.
Yes. So gastric sleeve for both?
Yes.
Why did we choose both the same? Because you offer many different procedures.
Well, ultimately, it's up to the patient. We try to educate them the best that we can what the options are.
Yep.
But they pretty much chose that procedure on their own.
Okay. Now, before, I don't want to show any before pictures, anyone, not just yet. Okay, we'll get to that in our next segment. I want to find out at what point were you looking in the mirror, or you both being best girlfriends, out for lunch or dinner, did you go, enough? Where were you? At what point?
For me, it was kind of a light bulb moment when I was out of town, and we had discussed it prior, but I was always the one that was like, okay, let's try diet and exercise. Let's try something, you know, I was always the voice of reason. So the light bulb moment for me was when I was out of town and I was with my mother, and we had all of my children with me, and my mother was just running around with my kids, and I didn't have any energy whatsoever, and I thought, okay, this is it, something's got to change. So that's where it began for me.
Okay. What about you, my darling?
I had a lot of health issues that went along with my weight, and my dad actually had a massive heart attack when he was 34.
34.
And 34 was the exact age that I had this surgery, and I decided that I was gonna get a hold of all my ailments, you know, while I could, and it has. Wow. I'm no longer on any medications whatsoever. It's taking care of all of everything.
Before, as I said, I'm going to show the pictures in our next segment, but what weight were you when you first went in for your first consultation?
255.
255.
Was my highest, yeah.
I was 225.
Okay. How has your life changed? Forget the medication part. Let's talk about lifestyle, because that's what people want to hear.
Oh,
Are you
absolutely.
out running around and
Yeah.
buying clothes?
Oh,
and
yes.
wearing the heels?
Yeah, most definitely. And I have an 11-year-old little boy, and you know, I couldn't get out and do all the things I wanted to with him before.
Yeah.
And now we're out, you know, running around, and I'm outside playing sports with him, and you know, we're doing a lot of things that we didn't have the
Energy.
for.
Yeah.
Yes.
A lot more energy now?
Oh, yes.
Much.
Okay.
Yeah, much
Yes.
more energy.
All right, we're going to get back into it. We want to ask you lots of questions when we're back after the break. Welcome back to Midday Kentucky, everyone. Well, of course, we have the famous Dr. Eric Smith from Georgetown Bariatrics and Advanced Surgical Services here with two of his amazing patients and their success stories, Christina and Nikki. How are we both? Good to see you all again. Alrighty, I want to talk about gastric sleeving, which is what we had done. We're going to show a little video, Dr. Eric, of how it works. Explain to everyone at home what it is and how it works.
The easiest way to explain it's a restrictive procedure, so we're doing something to cause the patient to feel full quicker with less food. They absorb everything that they eat, they just feel full quicker. And so in a sleeve gastrectomy, essentially what we're doing is we're taking the stomach and turning it into a long cylindrical tube, almost like a banana.
Right.
The best way I can explain is what I tell patients is your stomach now is like a water balloon. You put it under the faucet, it's going to get 10, 15 times its size before it's completely full. And now your stomach's like a water bottle.
So
when the
this
water
is the
gets to the
stomach
top,
that
it's
we're
full.
looking at?
Right, that's a normal stomach right there.
Okay, and you would put a sleeve halfway?
No,
or?
so there's no device that's placed in the patient. So we would staple off a portion of that stomach. I don't know if it shows that on the video, but we would staple off that large portion to the right and turn the stomach into the kind of the shape of a banana or a long tube. And
Gotcha.
so it's not going to stretch, it's not going to expand. When it's full, it's full. If you put a water bottle under a faucet, when it's to the top, it's full.
It
as
is what
opposed
it
to
is.
it dilating or stretching.
Can you, over time, you know, people have said in the past that, well, I put on weight after I lost everything. So can you stretch that out again by continually overeating?
No, if it's done right, if the surgery's done right, then the sleeve is not going to stretch. Your tool is always there. But here's what you have to understand. Let's take 2 water bottles and pretend that's 2 sleeves. In one of those water bottles, I can take a piece of grilled chicken and I can cube it up. And I'll drop those cubes into the water bottle and fill it to the top.
Yep.
That patient's full. The other one, I'll put it under a dispenser for a milkshake.
Yep.
I'll fill it up with a milkshake. That patient's full. One's going to lose weight, one's not. So it's how you use your tool, you know, and how you get full with that is how effective that's going to be.
Okay, so it's still about the content of what goes in the mouth.
Absolutely. Absolutely.
That's what we all do.
That's huge. You have to get full on the right foods, and
Yeah.
that's what we spend as much time, if not more, educating patients about than just the surgery itself.
And let's just talk about that, the education after the operation and all the procedures. How was that for you? Were you expecting that to be so in-depth?
We were really impressed with
Yeah.
how in depth that him and his whole team, you know, explained everything before and after.
Yes.
We left there feeling like we knew everything that we needed to know, and then if there was something to arise that we may have missed or needed to know something about, then they were a phone call away. Still
Okay.
are.
Yes,
So,
absolutely.
So you had the operation how many months ago now?
5.
5 months.
Yes.
Let's bring up your before and after shots to begin with. So let's
Okay.
just start with this. Here you are. Now, how much did you say you weighed when you first took that picture?
The first picture, the before picture was 225,
And you are,
150.
and how long ago was that picture?
That was about 5.5 months ago.
Wow. That is truly amazing.
Yes.
Show us the others that we have. When you look at that, what do you say?
Oh, I'm
You
just.
must say something in your mind.
I'm so very thankful.
Yeah.
I am. I didn't see myself like that before, but looking at the before and after pictures, you know, you can really see the difference when you compare the two.
Yeah.
And
What else have we got? Wow. Christina,
Yes.
talk to me.
Like she said, I didn't see myself that way, nor did my family, but pictures don't lie, and that's just, to me, I feel so blessed.
I want you to be honest with me.
Sure.
How would you have felt, and tell me if people have said this to you, Dr. Eric, if one of your family members had said, you need to get help? Would you have listened?
Absolutely.
Really?
Yes, absolutely. One particular family member did. My mother, she was my biggest cheerleader, and she was behind me 100% and
Yeah.
agreed that something needed to be done, you know, so I proceeded with it, and I would do it 1,000 times over.
Dr. Eric, when you hear something like that, how do you think is the right approach to say to a friend or a loved one, hey, I think it's time?
Well,
Because it's such a personal question.
Absolutely, but I think you can't lose sight of the fact that it's a disease. You know, if someone's blood pressure is out of control and they're ended up in the ER with chest pain, or they've had a stroke, no one would think twice about sitting down with that person, family member, and saying, if you don't do something, you're going to die. And for some reason, because it's a disease that we wear on the outside, that we're afraid to be honest with people and say, if you don't do
Interesting.
something, it's a disease. It's classified as a disease, and it's not 100% self-inflicted, and people need to stop thinking that and saying that. And so, you know, I tell them from the beginning, look, I'm always going to be honest with you. And so if you're struggling, if 6 months into it they weren't doing what they're doing right now because they weren't putting in the work, I'm going to be honest with them. But there's a right way and a wrong way to do that. And, you know, when I tell them when you pick a surgery program and a team, you have to find somebody that you feel like you can be honest with. You know, or if you're afraid someone's going to belittle you or tear you down, there's a good chance you're not going to show up for follow-up, and you're just going to hide if you mess up. And they need to have that comfort level that they're going to be able to approach somebody and say, look, I'm struggling. If it was easy, they wouldn't have come see me in the first place.
I got you.
Yes.
He's pretty amazing, isn't
Yes.
he?
Yes.
Very much so.
His team is really great.
Yes.
The hospital is amazing
Yes.
as well.
Yes.
All right, we're going to come back. Welcome back to Midday Kentucky, everyone. We've been hearing the testimonies of Christina and Nikki, and they're here with Dr. Eric Smith from Georgetown Bariatrics and Advanced Surgical Services. We've seen your incredible before and after shots, ladies. Amazing.
Thank you.
I want everyone to know at home, Dr. Eric, in regards to insurance, because you both had it done on your insurance. This is gold, everyone. Dr. Smith, explain to us how that all works.
Well, the majority of our patients have insurance that covers the surgery, and every insurance is different. But we have an insurance coordinator that works just for us for bariatric surgery. That's her main job. She knows the system better than anybody. And so the very first thing that patients go through is they'll meet with her, and she'll check their insurance benefits, and not just if they have benefits, but what the requirements are for their specific insurance, and kind of what things they have to go through to have it approved.
Okay, so how long is that process? You go in for your initial seminar, I believe, ladies, is that the correct terminology? And then the next step, what's then?
That's our big initial intake appointment.
Right.
And that's when we're there all day, and we see, I believe that's when we see the psychiatrist that day. We speak with we speak with the nutritionist that day, and kind of get a feel of what we've been doing versus what we need to be doing.
And at this point, are you approved?
Yes.
To go to the next level?
Yes.
Okay.
Yes.
All right.
Yes.
And what relief did it feel like when you were told you were approved?
Oh, we were
wow.
ecstatic. We were so excited. It was a 6-month process with our insurance that they require prior to beginning the process at
Right.
Dr. Smith's office. So, during that time, we're required to lose a certain amount of weight as well.
Are you?
Yes.
I didn't realize that.
And every insurance is different.
Okay.
Some insurances
Yeah.
require a certain percentage or a certain number.
Right.
Some insurances just say you need to maintain your weight. But my thing on that is even if you're not required, if I see somebody in 6 months who now we're providing education and they know they're preparing for surgery and they come in and they've gone up 20 pounds, we're going to sit down. I don't care if they're going through insurance or they're paying self-pay. I'm going to say, look, we need to figure out why this happened. Because if we don't correct this problem, the tool that I'm giving you is not going to be effective.
Right.
Interesting. I want to just bring up the video of this incredible robotic surgery that you do, Dr. Eric. Let's bring that up and you can explain to everyone what it is and why this machine is so crucial to your operations as well.
So, robotic surgery, I tell the patients, is just the most advanced minimally invasive surgery that we have currently. It takes the technology of laparoscopic surgery and just increases our ability to manipulate tissue, be much more precise, see better, handle tissue better. One quick example is, the movement of an instrument is completely steady. The force of a tremor is not strong enough to move the robot. So fortunately, I'm young enough that's not an issue right now, but
It's
one
quite
day it may be.
impressive.
Yeah.
It's really impressive.
So
Can I go on? Sorry.
We do more robotic bariatric surgery than anybody in the state of Kentucky.
And that says a lot.
Yes.
I just want to
Yes.
share with everyone at home, because I think this is super important to know. Your life changed, you were approved by your insurance, and your copay, listen to this everyone, was $250. Your medical bills for your prescriptions were more than that amount.
Oh, yeah.
Correct.
A lot more.
So why wouldn't you want to have that next step in your life? When you heard that, what was the relief for you?
A tremendous amount of relief. I was shocked, for one, because I had no idea that it would even be that small.
Yeah.
And
So was I when you told me.
and that's a drop in the bucket compared to a healthier lifestyle and
Yes.
and a complete just whole new outlook on everything, mentally, physically, everything.
What do you say, Dr. Eric, for people sitting at home and they go, oh, this was always been out of my reach. This is something I could never do. What do you say?
It's one of the many assumptions that goes along with it.
Yeah.
Is, I think you've got to get information from people who have the appropriate information. And that goes from thinking it's a cop-out, thinking it's an easy way out, which it's not realizing that we're treating a disease just like you would with a medication, to getting people to understand that, look, it's not the misconception of it's too expensive or it's unsafe is just untrue. And that's when, if you come to a seminar, it's free. You can walk away from that and say, it's just not for me or I'm not ready.
Yeah.
But all that information can be provided to you in a free fashion so you know the truth behind how effective the surgery can be, how much weight you can expect to lose, what some of the medical problems that you have can be resolved.
Well, I think it's amazing. We're going to head over to break. If you want to find out more information about Georgetown Bariatrics and Advanced Surgical Services, there it all is up on the screen, everyone. Welcome back to Midday Kentucky, everyone. Well, you've heard the most incredible stories throughout the whole show from Georgetown Bariatrics and Advanced Surgical Services. Christina and Nikki, incredible work. Dr. Eric Smith, always.
Thank you.
I wanted to bring up the website, everyone, because we've actually had messages on our phones since this show's been happening that people are interested in on how to get involved and how to actually start that consultation. We're going to put it all up. As you can see it now, it's pretty simple. There's also videos on there of the conversation that you can have there. Just go in and put your details. The office will call you. Don't worry. Start the new year with a new you, everyone. 2019 is your year. There's all the information. Have a wonderful weekend. Eat something healthy. How's that?
Yes.
Yes.
Have a great weekend. See you guys.
All right.
Thank you. Bye.
Thanks.